Hi, everyone, and welcome to today's webinar, The Role of Customer Operations in Healthcare. On behalf of Becker's Healthcare, thanks so much for joining us today. Before we start off, I'm going to walk through just a few quick housekeeping instructions here. So first, we will begin today's webinar with a presentation, and we will also have time at the end of the hour for a question and answer session. So you can submit any questions you have throughout the presentation by typing them into the Q&A box on your screen. Today's session is also being recorded, so it will be available after the event, and you can go ahead and use the same link that you used to log into today's webinar to access that recording once it's available. And if at any time you don't see your slides moving, or if you have trouble with the audio, just try refreshing your browser, and you can also use that same Q&A box to submit any technical questions as well. We're here to help with those. So with that, I'm pleased to welcome today's speakers, Omer Minkara and Drew Kerner. Omer is the Vice President and Principal Analyst at Aberdeen, and Drew is the Global Head of Providers in ServiceNow's healthcare practice. With that, I'll now go ahead and turn the floor over to our presenters.
Great, thank you. And hi, everyone. This is Omer Minkara. Once again, a heartfelt welcome to our session today. We have a great conversation prepared for you with a quick journey that we're going to be taking together. So on the screen, you do see a couple housekeeping items related to what our journey is going to look like. And then in a minute, we're going to talk about a couple other housekeeping items, such as what's in it in today's webinar for you, some quick takeaways before we dive deeper into them. So high level, we're going to have 3 different stops in our journey. The first stop we'll make is what are the strategic priorities for today's healthcare organizations as it relates to their customer/patient operations. So anytime today when we talk about the word customer, we're essentially talking about the patients for healthcare organizations. Then we're going to talk about how to use operations to deliver top-notch CX or patient experiences. And then finally, we're going to talk about communication and collaboration across the different silos in healthcare organizations. A big challenge. I know I'm getting a lot of inquiries on that, so we're going to talk about some best practices. And I'm really excited, Drew, to be co-presenting today with you to get your perspective and share your perspective with our attendees. Also, welcome once again to our conversation.
Absolutely. Thanks so much. Looking forward to it.
Yeah, thank you. And finally, for our audience members, 2 quick things. We are going to have a Q&A session towards the end, so please share your questions as we go through our content today. But also, we're going to keep you involved in our conversation. We'll have a few poll questions, and we want your answers. We want to know what's the state of your business so we can really tailor our conversation to the best of your needs. Now, with that, let's also talk a little bit about where is our research that we're going to be sharing today with you coming from. So recently, as Aberdeen, we have surveyed more than 1,300 organizations. Those were organizations of different sizes. Essentially, all of those organizations had over 1,000 employees in their service and back office. So, and what we studied within that survey was how did they manage customer operations in the service environment, in the back office, and operations activities, so we can figure out what good looks like. What are their challenges? How do they get rid of them? And what are the benefits? And as a result of our analysis of healthcare organizations that participate in our survey, here's what we uncovered. When businesses are implementing a best-in-class customer operations program to manage their patient experiences, to better manage their operational activities, it has huge payoffs associated with that. So on the screen, you're seeing 4 different metrics that are very important for many healthcare organizations, ranging from productivity to patient satisfaction scores, to operational costs and employee utilization. And across the board, the best-in-class organizations that we're going to talk about are reporting some phenomenal results. As you can see up top, almost 25 times the annual increase in employee productivity, 24.6 times to be exact. So there are reasons behind that. There are some best practices, and we'll touch on those. There are also best practices that create happier patients that are more positive, really become evangelists, really loyal patients who have full trust in those healthcare providers. So we'll talk about that as well as how those healthcare organizations are reducing costs. So quickly, before we dive deeper into those research findings in a deeper way, what are some of the high-level insights that we're hoping to share with you? So high level, we're going to talk about how customer operations brings all the different operational silos that impact patient needs and business operations for healthcare organizations. So those are service, back office, and operations. We're going to talk about how best-in-class organizations are reporting service and operational cost reduction. So there's some interesting observations that we're going to be sharing there with you, with some comments from Drew on real-life success stories. And then we're going to talk about some 4 key pillars. So, some best practices that you can start implementing in your business right away, along with the impact of workflows. So with that, why don't we get started with our conversation, taking a look at the top strategic priorities that's driving customer/patient operations. Now, on the screen here, we have 2 different colors. And we're going to be looking at service leaders within healthcare organizations and back office leaders, back office and operations leaders in healthcare organizations. So the companies in orange here, or the orange bars, are indicative of respondents from service leaders, and the teal bars are indicative of back office respondents' responses. Now, a question that we asked in our survey was, what are your objectives? At high level, what are the things that you're trying to achieve as a healthcare organization in terms of order of importance? And as you can see here, the number 1 goal, both for service and back office leaders, seems to be the same. That is, improving patient experiences. So creating happier patients, healthier patients, but also driving positive word of mouth, loyalty, and trust. In the back office, that seems to be less of an objective, not to say it's not important, but because of the nature of business activities, you do see that sort of wide gap. But nonetheless, the number 1 goal is still creating happier patients. As you move down the list, you're seeing other factors in play. That is, regulatory compliance. You have internal and external SLAs. That's, again, very much top of mind area for service organizations, but also equally important for back office. In fact, we hope that it's even more important in the months and years to come. We're going to talk about cooperation and collaboration across different departments and the willingness to do that, but you're seeing that that's also one of the objectives. In fact, that's an area where back office leaders are saying that they would like to do a better job in this area, and again, more to come on that. You're seeing compliance with external and internal business rules as another area, both for service and back office organizations, and then cost. This should come as no surprise. Costs are increasing across the board, labor costs, operational costs, and we're going to talk about how best-in-class organizations are actually reduce both their service and back office costs. And then you're seeing productivity. In the back office, productivity has always been a key metric and key objective, and as we can see here up top, next to the red arrow, cost reduction is still, along with productivity, an important back office objective, and we'll see how the best-in-class manage against that. And then finally, as you move further down the list, you're seeing delivering effortless patient experiences. The last thing you may want to do as a healthcare organization is creating conveniences for your patients just when they need support and care. So you can see that sort of emphasis here, along with that loyalty and trust. So the better you do in terms of delivering effortless experiences, syncing up customer operations activities, the more likely you're also able to generate loyal patients and word of mouth to grow revenue, which is, let's face it, still important for healthcare organizations. So with that, I use the term customer operations quite a bit throughout our conversation today. And a lot of our audience members today may be asking, Omar, what exactly do you mean by that? I've heard it, or I may not heard of it. I'd like to have a cleaner explanation of what exactly it is. So I'm not going to read through line by line here, but high level, customer operations is essentially a healthcare organization synchronizing activities in the service part of the business, so customer service, and the back office, including scheduling appointments, managing medical records, ensuring insurance coverage, all of that, conducting on-site and clinical work. So all of that being harmonized to deliver seamless patient experiences. And let's face it, this is not an easy area, but the good news is we're going to be talking about how the best-in-class organizations are going about that. Now, Drew, I do want to get back to you here. I know you work with many different organizations on their customer operations programs. specifically in healthcare. So I'm curious to see, how does our conversation so far, the data that we've gone through around the challenges, the goals, how does that align with your observations working with healthcare organizations?
Yeah, I think it's really interesting seeing the survey results in my background. So I work for a hospital system here in Colorado, and our mission statement was to provide world-class patient care, which we actually measured by being in the top 10% of all of our quality measures. And that was all the way down to the janitor and to the IT folks that even weren't doing the direct patient care. And it's interesting, as we prepared for this webinar, Omer and I were talking, and I was kind of curious to say, okay, why do we say customer, not patients? And the reality is, at the end of the day, that North Star is the patients, but some of those direct customers that some of the other service lines deliver to are not the patient, right? So we always know in the top of mind that those are the patients, but for someone like IT or even for legal, then a lot of times their direct service line, their direct customers are the clinicians. And so, and it's interesting too, I think just in general, that's where you see that shift with even the previous survey results are, again, for those front office folks that were in those orange bars, again, their focus is primarily customer focused, but again, for the mid to back office folks that are on the back side, they're looking at things like the operation, more cost concerns, those types of things too. And so, at the end of the day, it is that we're all delivering those services from the top level, whether they're radiology, cardiology, oncology, but again, those customers are going to be different depending on who they look to. So those were the interesting things that I've seen. And one other thing I'll mention before I toss it back to you, Omer, is the market is shifting too. So everyone most likely on this call is shifting over to a fee-for-service or from fee-for-service over to fee-for-quality. And then we've had this interesting thing, the pandemic, that has inserted itself in about a year and a half ago that has really changed a lot of these delivery models. And so the models with how we're delivering these customer operations are shifting as well. So the hospitals systems that are the most nimble and able to react to some of these challenges are the ones that are going to be the most successful too, again, keeping in mind that the patient service is the top of mind. So
great. No, those are great observations based on your experience as well, Drew. So I guess before we continue with our research findings and some other observations, a question to our audience members, and I'll switch to the question. But Drew, if you wanted to maybe go through the question, we'll quickly go through the answers once we collect our audience's insights. So I'll turn it over to you before we continue with the rest of our conversation.
Yeah, so one of the things, and again, that Omer touched on earlier, is this concept of the network integrity and keeping patients within the system and at the same time attracting new patients. And so the first question we had, and we'll pause for a response here, is what do you think what do you use customer operations to manage? And more specifically, again, I know it's all of the above, but what I would say is what's the most important critical piece during that patient intake process? So scheduling the appointment, the billing aspect, insurance coverage, or the medical records. So please respond with what you think is the most critical aspect to the customer operations management. We'll pause for a couple minutes and then look for responses.
Great. And as we're waiting for the responses from our audience members, Drew, any guesses from your perspective? I know it's usually tricky to make a guess, but just curious to see based on your observations, if you had to pick one, what would be your pick?
Yeah, so it's funny because a lot of these challenges are different globally, so we have our own initial challenges with billing and insurance coverage. So I would bet that it's going to be one of those two, if not billing specifically, but I could be completely wrong. So.
Great. Seems like we have quite a few respondents, so we'll maybe give another 5 or 10 seconds before we close it off and take a look at the answers. All right, so let's go ahead and close it off, and let's see the results. So they're on the screen. It seems like many of our attendees, about three-quarters of our attendees have said scheduling is an area that they're really trying to focus on, which having gone through some of the scheduling issues myself for for some healthcare conversations seems to be tricky, but there's a lot of agility and flexibility that we're going to talk through as it relates to how customer operations is helping through with that. But I guess, Drew, handing it back to you to see, what's your take on the results that we're seeing here on the screen?
It makes sense, and again, it's interesting. My math major is trying to add up the totals, and obviously, I think you could pick more than one, which is great. So, but that's really a critical piece, and part of what we're looking at too is, again, how can we make some of these experiences happen better, and that appointment scheduling is at the top of the list as far as when that patient is, even existing patients, new patients, and that appointment scheduling, and ideally not transferring the call from that when that patient calls in is pretty critical. So that makes sense, especially, again, given those others are fairly clustered together as well too. So.
Perfect. Well, great. Thanks for all our attendees for sharing your perspective. Again, we're going to talk more about how customer operations helps with the line items here, including scheduling. And just want to recognize that we have 2 audience members already having asked us questions. We're going to be answering them momentarily. Funny, one of those questions was essentially about scheduling right before we dived into it. So more to come on that. But now we're going to talk about the challenges. So we heard from our audience members on what are some of the areas where you're using customer operations. Now let's see, what are the areas that healthcare organizations in our survey have told us that they're struggling? So how could customer operations help build and demonstrate a quantified impact for the business? So multi-choice question. I know, Drew, earlier you said you were a math major, so for the percentages, they're not going to add up to 100% because there are multiple challenges, right, for many healthcare organizations. So we're going to go through the ones that are most pressing that our respondents have reported back to us. So number 1 pressure was increasing costs for healthcare organizations. And this should not come as a surprise. It's not just the healthcare organizations that's facing it, it's across the board. But this is one area where we're going to see how best-in-class organizations are actually able to reverse the costs by driving better efficiencies. So we'll chat more on that. Another area is delays in addressing customer support needs. And I think this speaks squarely around the scheduling as a focus area as shared by our audience members in the polling questions. So being able to address the customer's questions, being able to get them in for a patient visit. We had another question for telehealth or online health. So we'll talk about the flexibility and workflows associated with that. And then another question or another challenge that we've captured data around that seems to be the third top challenge is keeping up with changes in patient needs. Business conditions change. Guess what? 2 years ago, there wasn't a pandemic, and there is now, and who knows what we're going to be facing next year. So business conditions change, patient conditions change, their expectations change. So we're going to talk more about flexibility. And then lack of shared objectives. It seems that service and back office leaders do want to have more shared objectives to be able to promote and execute on collaboration. So we'll talk about how to build those. Now, one term that I've used previously was best-in-class organizations. I mentioned that we're going to turn to the best-in-class organizations to find out how they're managing customer operations. So before we get into the building blocks that are deployed by the best-in-class, let's talk about who those companies are. Now, again, 1,357 organizations that we've surveyed. We can't disclose the names of every organization just because of privacy, but I can say that we have used several different performance metrics, 4 metrics in particular, to be able to gauge the top 20% of the healthcare organizations as it relates to customer operations. So on the screen, you're seeing the metrics we use from a patient perspective. So how do they deliver a demonstrable impact for their patients? Seems like the top 20% of healthcare providers are able to retain much more, about 30 to 40% more of their patients year over year. And this doesn't mean, by the way, that the patients are going back to them repeatedly for the same issues. Rather, this speaks to trust. It speaks to the fact that those healthcare organizations are trusted in addressing the patient issues, and whenever there's another issue or loved ones have issues, they're always referred for quality care. And that is directly in line with the patient satisfaction scores at the bottom. As you can see, there's about an 8 times greater annual improvement reported by the best-in-class organizations. So it seems like the best-in-class firms are doing the right things to deliver on patient expectations. But what about operationally in the back office and efficiency perspective, how do they manage? Well, it seems like they're also succeeding as it relates to productivity. So it could be, for imaging, for, in-office visits, however you look at it, productivity is improving much, much more drastically year over year for the best in class. And when the customers have issues about billing, when they have issues about scheduling, those issues are addressed much more frequently at the first touch. So customers don't have to repeatedly call back for addressing the same issues. So that's what the best-in-class organizations have told us. That's how we measure them. But there are some additional benefits. As you can see, there are two separate colors here on the screen. The ones in purple are the best-in-class healthcare organizations, and the ones in gray are all other organizations. So when we look at the year-over-year change between the two categories, we're seeing that the best-in-class firms are improving the employee utilization rates by almost 24 times year over year. So that's a big, big improvement. And scheduling is one way. So a lot of our attendees have said, we'd like to do a better job in scheduling. As you can see, the best-in-class is really excelling precisely in that area. So in our next section, we're going to talk about how they do that. Before we get there, though, patient satisfaction was another area we looked at. As you can see, year over year, because their patients are more satisfied, the best-in-class organizations are also reporting that patient trust levels, the retention and loyalty improving much more drastically versus the peers, along with the quality SLAs, which is important. Now, early on when we were talking about challenges, I talked about increasing cost as the #1 challenge as reported by our healthcare respondents in our survey. So how are the best-in-class doing in that area? It seems like the best-in-class organizations, the ones in purple here, are achieving some pretty good annual improvements. That is a decrease in both service costs and back office and operational costs. Again, we'll see the methods that they use to achieve those reductions, but by introducing better efficiency, they're also able to improve their profit margins. That is, they reduce costs and grow their revenue by creating happier customers, finding opportunities to expose their patients about additional services that they could provide. So they minimize the patient effort. They address patient needs while delivering more cost-effective and profitable care. Now, with that, Drew, another question to you. I'm really curious to see what are your thoughts on why customer operations is helping healthcare firms, best-in-class firms to be exact, drive such cost reduction and also profitability, to be frank.
Yeah, so I mean, at the end of the day, what I see is again this consumerization of healthcare, and so we're all patients at the end of the day at some point in time, or we have family members that are going through the process, and so everyone wants to have that consumerized experience as far as we use the term Amazon-like because it is so easy to buy something. And so, the thought is, why can't we get that same experience within our healthcare lives? And so I think that those high performers that you mentioned, Omer, are taking a lot of that adoption and saying, hey, how can I get that answer to the question about my bill or a question about my medical record or the ability to schedule an appointment? And really have that when they call into the patient services representative or into the hospital, having that person be able to answer that question with one single call. And so, and not have to answer the same questions 5 times and have that case history as far as when they contacted when they've called previously. And so, that's what we start to see ideally. And the other piece to it is to deliver some of the omni-channel experience as well too. So a lot of the younger generations, they don't necessarily want to make a phone call. I know my kids rarely make phone calls, and so they want to have the ability to text and or to use a website or a virtual agent or, having multiple modes of communication, not only with the hospital system itself, but even with the care providers, their doctors at the end of the day, is becoming more and more critical to create that consumerized experience. And so I think this is where we start to see, again, as patients, which again we all are, shopping for services, having some of the ability to interact with the hospital system itself and some of these new methods is going to be pretty critical to the process.
Thank you for that again, and I definitely agree with that sort of patient engagement, right? So engaging patients where there's the least path of resistance, or where they'll get the most quality care from their perspective in an effortless way. So more to come on that in our next section. But before we do that, I do want to acknowledge that we have received a few more questions from our audience members, so please keep the questions coming. We'll answer them in the Q&A part of our conversation. Now that brings us to our next section, the second section on how to use operations as a business to deliver top-notch patient experiences, patient/customer experiences. So before we get started with what are some of the things that the best-in-class healthcare organizations are doing, Drew, I'll hand it back to you for another question for our audience members.
Sure. So this should be a fairly simple question, but we wanted to get an idea of where you feel your ability to gauge the process and the efficiency and impacting those issues. So the cool thing is I think some of the questions coming into the chat are asking questions about this specifically, but again, specifically, how satisfied are you with the ability to gauge and address process efficiency issues impacting customer operations? So as a system, are you satisfied, neutral, or not satisfied at all? So fairly straightforward answer. I think there's only one response available here.
Right.
We'll give a couple minutes to respond. So.
Great. I think it's always hard to gauge the exact percentages, but I'm very eager to see our audience's perspective. In the meantime, I'm guessing we may land somewhere between neutral to not satisfied in terms of the trends, but definitely eager to see where the trend lines are going to be putting us in, and we'll definitely talk a little bit more about what are some of the attributes of best-in-class organizations that are satisfied in this area, but also that do achieve some demonstrable positive results. So more to come on that. So we'll give our audience members maybe another 5 or 10 seconds to respond to the question, and then we'll continue taking a look at the results and moving through.
Yeah, and I would guess the same, Omer. Again, I don't think they'd be on this webinar if they thought everything was perfect, but I guess I was wrong on the last one, so I guess we'll see here too, right?
Perfect. Well, let's go ahead and take a look. All right, well, you were right in this case. But if you want to, I don't know if you have anything to, this is kind of self-explanatory, but if you wanted to add anything here, definitely eager to hear that.
Yeah, I think it's pretty straightforward. Again, I think there's probably places where folks think they're doing a good job, but at the same time, can always improve at the same time. So pretty much what you had posed out there, Omer. So.
Perfect. Well, great. In this case, the good news is we are going to talk more about those best-in-class organizations. By the way, kudos to all of you who are already satisfied. The next slide is essentially a great checklist that you can use to see, what are you doing today? What are you not doing today? Even if you're satisfied, there may be pieces that you're not using. So I really find this section really the how-to section. So how do you build a best-in-class customer operations program that delivers better patient experiences, reduces costs, and all the other benefits that healthcare firms are looking to achieve. So there are 5 different pieces, and we're going to go through each one in order. So starting from left to right. Again, same color scheme, by the way. Companies in purple are the ones that are best in class. The ones in gray are the ones that are all others. And the way to read this chart here is 83% of best-in-class organizations have regular audits to gauge and address process inefficiencies as compared to 60% of other businesses. So having covered that, you can see that there's a correlation. Not necessarily direct causation for everyone, but there's a correlation between using those activities and achieving better results. So what this tells us is, as a healthcare organization, if you're not regularly looking back into what activities are responsible from repeat contact, what activities are responsible from poor patient satisfaction scores, what activities are typically responsible from poor scheduling. And that's where analytics, that's where things like AI and workflows come in. And Drew is going to talk a little bit more about that in terms of how they're used. But if you're not using that, that's an area that we highly recommend you to focus on. Another area here is quality assurance. So really looking into what are the SLA, service level agreements that you set inside your business, but also the organizational and regulatory standards, and looking to see where are you falling in that spectrum. Are you ahead of them? Are you falling behind? Are you somewhere in the middle? How could you keep going to improve your activities over time? So again, if scheduling is sort of your North Star, if you're trying to do a better job in this area, scheduling accuracy is one. If you're trying to improve on patient experiences more, so and it could be multiple objectives at the same time, but having those metrics absolutely helps track where you are and where you're going. And then workflows. So looking into the statistical, so where is the business today? How do you typically manage and execute the workflows? And reiterating. So as the business needs change, do you need to improve your billing practices? Do you need to improve your scheduling activities? So that all goes in tandem to be able to improve efficiency over time. And then managing activities in real time. So as a healthcare organization, you want to see activities in real time, because if you're managing for the activities of 3 months before or last year or even last month, a lot has changed, right? So there may be a sudden, pandemic that's emerging. That's, that's more of an extreme scenario, but it is what we're living through today. So being able to really understand what are those local issues, what is the patient expectations and the business conditions, and responding in real time is another way. And again, workflow automation is critical for that. And then towards the right, a fifth building block before I hand it back to you, Drew, to get your take here, is utilizing digital services. So if patients are going on the website, they're trying to schedule appointments, they pick issue types, they're trying to file new patient registration forms, for example, then they're trying to articulate their issue. Those are all potential data points that you can collect to really understand what are the business conditions, how are they changing, do I have enough specialists in that area that are available, what location is seeing greater demand. So again, digital transformation is really expediting in terms of how healthcare organizations are responding. So that's a great opportunity to really understand the change in patient expectations. So with that, again, I want to hand it back to you, Drew, one more time to see if you can share an example or maybe two from healthcare firms that you're working with and how they're using workflows to, support all of those activities that we just looked at.
Yeah, I think there's a couple I'd like to touch on, and it's really kind of interesting because, again, we've used the term workflow a lot, which is primarily where ServiceNow focuses. But if you focus on that center column here, at the end of the day, if you take a bit of a step back here and define the way we define services, I need to get information, I need to get something new, or I need to something I have is broken and I need to get fixed, right? So there's those, primarily a lot of the services that we define fall into those buckets. And part of the problem too is there's a lot of different departments within the healthcare process or within the healthcare environment that decision could be made as part of that process. And so a couple of the examples that I'll bring up are one really cool example, and in general we always try to get folks to think about things a little bit differently in the care delivery model. And so one of our hospital systems was just the example is he was in the hospital with his father and said didn't feel like he was getting the care that he needed, and so he said there has to be a better way. So he architected a solution which replaced their existing nurse call system that, again, routed that work to the proper fulfiller on the back end. So if that patient requested for nutrition for lunch, it would go to nutritional services. If it was the room was cold, it would be routed over to operations or to facilities, all the way up to request for warm blanket would go to a CNA or to a lighter tier nurse, all the way up to my pain is increased would go to the doc. So it's a really cool example, again, and this doesn't have to be replacing full nurse call, but the routing of that work in particular to the right fulfiller versus having that nurse go into the room 40 to 50 times per shift, but only the 20 or 30 that were relevant to them is a huge satisfier, not only for that patient because they got their services faster, but also for that clinician because they only had to respond to the things that were relevant to them. So again, a great example of kind of touching both of those customer entities that I mentioned earlier too. And the second one that I'll mention is, again, we are in this shift to that home health care, and I know we have a question coming up in the chat that will touch on this, but back when COVID first hit in beginning of last year, we had a hospital system up in the Northeast that went from about 3,000 virtual visits in all of 2018 to 3,000 a day, and so there was definitely a need to shift those services out. That we'll touch on some examples here, but they had 1,900 total beds in the system and 2,100 positive COVID patients, so they needed a way to communicate with their patients, which may or may not have even had a record within their medical record system, and keep track of the responses and deliver them information. So again, we worked with them to build up a solution that said, did some self-reporting based on their symptoms, and if there was any potential change, then we could dynamically spin up a session there too. So again, the cool thing is about this was stood up in a couple of days, and so this concept of this rapid innovation and be able to step in again, is I'll touch on it in a second here when we talk about some of these newer workflows, but again, changing some of these expectations and not depending on potentially even some legacy systems and workflows, and just in general thinking about things a little differently are probably some of the things that our high performers are doing in general. So.
Thank you for that. And those are some eye-opening numbers that you've shared with us, 3,000 a year to 3,000 a month. I think that's where the flexibility and proactive component comes in. We have another question that just came through chat around how to become more proactive, and just as you mentioned, right? So building the workflows, anticipating, all of that contributes. So we'll answer some of those questions in a more detailed way, but thank you for sharing that. So the last slide that I want to share before we skip to our next section and talk about communication and collaboration and start answering some of the questions we received was, how long does it take for organizations, on average, to start seeing the results that they've expected? So overall, when we looked at healthcare organizations, they told us that in 15 months after implementing a customer operations program, they've seen demonstrable and positive results that have met or exceeded their expectations. Now, two ways to look at it, and the way I look at this is you got to get started now, because the longer as a healthcare organization you put this off, the later you're going to start realizing those gains while your competition may be already going through their journey. So that's how I'm looking at this particular data. So we talked about how to get started with this journey on our previous slide. So next up is a very critical component of the customer operations programs, and that is communication and collaboration. Because let's face it, for a lot of organizations, this is where a lot of the inefficiencies comes from. That is, do I have the right employees speaking to each other? Do they have visibility into their availability? That even impacts scheduling, which was clearly a challenge for a lot of our webinar attendees today. So one question that was interesting in terms of the insights that we've gathered from our respondents was, what are some of the stakeholders in the business that are resisting change, that are resisting better communication and collaboration for managing patient activities and business operations? So we had a few different options to pick from, and it seems that back office organization, the operations and back office leaders, were the least likely to say, I would much rather have less communication and collaboration. They want more and better communication and collaboration. Interestingly, service teams, field delivery teams, the clinical teams, for example, they're the ones that were the highest that had the highest likelihood to resist change. They did not want as much communication or as frequent communication with the back office. And this is sort of where the conundrum is, where if those two departments or those different business silos are not operating in a harmonious manner, that's where the patient experiences are becoming inefficient and fragmented. So to build on that, though, what was also interesting here was, as much as the service organization is pushing back on better communication and collaboration with the back office is actually incurring a significant cost supporting those activities. And here's how. It seems that on average, 27% of the back office time, so those are folks responsible for scheduling, the clinicals and whatnot, 24% of their time is spent supporting patient support activities, so delivering patient service. Now, if you run a quick scenario here where you have an average of $70K in average labor costs, and again it changes by region, by provider, but if you stick with that, if you have 5,000 back office employees, that company that has 24% of the employee time spent supporting service activities in the back office is looking at $84 million. That's a lot of cost that's associated with service that's shouldered by the back office. So all that's to say that although the service leaders are pushing back for better communication and collaboration with their back office counterparts, this shows that back office is really delivering critical support for them. So this is just another way to really illustrate to the C-level, to the broader business leadership, and really get the back office and service teams back on the same team, really establish shared objectives. We had a question that came through earlier. How do I align my back office and service leadership on shared objectives? This is just one way, really illustrating the critical support that the back office teams are giving to the service organization. So with that, I'm going to share a few key learnings that we've gone through. Drew, I'm going to hand it to you in a minute for some additional takeaways, and we'll open up for answering the questions that we received and any other questions that may come through. But high level, what have we learned so far? We talked about customer operations and how it impacts back office and service success. We talked about how it helps with flexibility, with cost reduction, with growing profitability and revenue. And we also talked about 4 key pillars plus workflows. So we'll answer questions in a minute, but with that, Drew, I'm going to hand it back to you for some additional observations with our audience.
Sure, and I'll be fairly quick here, and just to kind of level set here as well too. And again, Omer, thanks for the time and presenting this with me today. And in general, the way ServiceNow is approaching this is from that workflow perspective. And one thing just to remind everyone of is at the end of the day, what we're looking to do is help folks on this digital transformation journey. And if you think back to that slide Omer showed a couple seconds ago, a lot of these optimizations on the patient services side can happen, again, with those back office folks. And so at the end of the day, again, how can we optimize some of these workflows and basically deliver the information to that patient services rep, to that person in the billing office that's trying to determine pre-authorization of benefits, to that person that's trying to determine consent forms from the legal perspective. A lot of that happens in different silo departments, and so what we're looking to do in general at ServiceNow is to automate some of those processes that are potentially manual and potentially even remove some of the paper in that process as well too. So again, we have this concept of a system of record versus system of engagement. So, a lot of these systems are in place already, whether it's the EMR, and we're not looking to really replace any of those systems, even from, again, those multiple systems on the back end, but how can we make those systems work better and faster and potentially close some of those gaps during the care process, whether they are in that front office with that patient services rep or even on the back end where we're managing a discharge process and scheduling follow-up appointments and those types of things. So if you pop to that next slide, Omer, what we're really looking to do again this concept of a data model we built and launched on Thursday of last week. And so the idea is, again, if you take that example I mentioned earlier of making a decision and providing some of those capabilities to that decision maker or the fulfiller doing that work, this is all built on top of the ServiceNow platform. And again, ideally at that top level there, these are some of the workflows that we've built in out of the box. And so it started with our vaccine administration management solution, which we launched about a year ago, which is primarily designed around helping not only our hospital systems, but cities and states and federal governments even to do the reporting of putting the needle to the arm and actually recording that activity, which at its core is really a patient access activity. And so taking some of those learnings around, reaching out to a patient and having those services defined, again, having other pre-built workflows built on top of the building blocks inside of our core data model that launched literally last week for the data model, or July for the data model as well too. So again, I think part of this is, again, not meant to be a commercial, but how can we potentially optimize some of these potential workflows that happen in this process? And ServiceNow is here to help, again, make some of those experiences happen even faster and better.
I think that brings us to the last section. Go ahead.
Yeah, Erica, if you have
I'm sorry, Omer. We were having some audio issues there. Thank you so much to Omer and Drew for a great presentation. As they mentioned, we'll go ahead and begin the Q&A box. So it looks like we've got some built up in the Q&A box already. So first here, the first question is, over the course of the pandemic, I've seen a deterioration in customer operations, especially with scheduling and billing. Have you seen the same, and if so, why? So Drew, I'll go ahead and pass that over to you first.
Yeah, so it's a big challenge, right? And I think that even before the pandemic, there was starting to be a shift out to virtual care and or telehealth. And so we definitely see that as most common. And I think what I've seen most hospital systems are trying to do is to create at least as close to as possible as that inpatient experience at home as well too. And so But the problem is with that care being delivered remotely, there's a whole other set of challenges, which include potentially even managing those devices at home, or even things like resetting their password on their MyChart account, those types of things. So in general, I think, and this probably will lead to one of our next questions, is capturing some of the common issues that happen as the shift happens, and then kind of tackling them in general. Again, ideally answering them as far as bucketing them into responses as far as, hey, is this an issue with my access? Is this an issue with a device? And as much as possible, trying to create that inpatient experience as we can at home. And again, of course, there's you can't do a surgery at home, or take a blood lab draw or things like that. But there's a lot of activities. Even again, with that statistic I mentioned earlier, I did a virtual visit with my doc for my annual visit last week, and it was great. Right, I didn't have to wait in the waiting room for 30 minutes. It was nice to be able to sit in my office and do those types of things. So, Omer, I don't know if you had any follow up to that.
No, I mean, exactly what you mentioned, right, Drew? So one thing that I would add is to be able to anticipate, higher levels of service in real time or almost real time. One of the things that we're seeing a lot of healthcare organizations really focus on is the preventive maintenance. That is, really focusing on wellness. So, minimizing what may have been, missed early on if patients are not taking care of their well-being. And then the other thing is really finding out what are the pinpoints, what are the areas that I can pinpoint that I can immediately prioritize for better scheduling, better efficiency. So I think a lot of that is already happening all at the same time, and we're seeing that transition. I think use of workflows combined with machine learning and AI is really going to transform the industry, because now you're able to pinpoint more correlations. So if a patient has the following attributes, or if they're have the following behavioral characteristics, they may need a little bit more urgent care, really helping shape the healthcare provider's journey in delivering support. So definitely agree with what you said, and I think we're going to see a lot more innovation come in the next several years as it relates to customer operations to address that.
Thank you both for weighing in there. Next here, can you please explain how healthcare organizations in general are approaching the issue of educating patients to transition to remote-based care and managing their health more remotely? Drew, I'll go ahead and kick it back off to you.
Yeah, so, and I think this came out in some of the survey statistics as well too, but it basically, and again, this is primarily U.S.-based construct, but knowing the change in the billing optics with the change to telemedicine, and how the services that the payers can pay out are basically equal now as starting even back as early as 2018 for specifically services. And so I think in general, the pandemic accelerated that whole motion, because again, a lot of those activities that we mentioned earlier, even just the standard visits, can happen pretty commonly. And again, there's even ever-changing policies that we see on a weekly basis now, even outside of COVID in general. But I think what the pandemic has really showed us is that a lot of things can happen at home, right? And so a lot of these activities are shifting to that virtual-based model. And the other thing too is, I think the other way that I've seen hospital systems maximize this is increased volume too. So you can theoretically have more virtual visits in a day than you can in-person visits if you can optimize some of that experience and process too. So there's definitely not just keeping up with the different changes as far as the regulatory on the billing side, but also increasing volume too, which sometimes can happen, sometimes cannot. But at the same time, I've seen a couple of those things happen. So, Amir, I don't know if you have any comments as well.
I think you addressed pretty much all the important points. I know we got quite a few questions from our audience members, so maybe we can take the next one.
Hi, the next question here is going to be, what are some of the ways that we can use to boost employee utilization to handle sudden changes in patient demand? And Drew, I'll hand it back.
Tackle that one first, and then I'll jump in.
Yeah, sure. So, from the research itself and, some of the conversations, Andrew, I'm really eager to get your take on this too. But really establishing more accurate visibility into employee availability. So really understanding what are the preferred times for employees, because let's face it, the employees are the ones that are, delivering all the care. Yes, they do have the tools and the processes, but their availability, their, work-life integration, all those are still important to be able to deliver quality patient care. So there's that piece that's important. The other piece that's important is also improving the accuracy in the forecasting process. So, looking into historical data to build baselines and being able to pivot in real time. So we talked about being more proactive. So if, for example, patients are going on the website, they're trying to schedule visits of a certain nature, maybe there's more GI specialists at a certain period in a certain location. So knowing that helps us ensure that we have enough GI specialists that are available in that region. So all of those are areas that I highly suggest, for doing a better job for employee utilization. But Drew, I'm also eager to get your take for some, tips and tricks for better employee utilization.
Yeah, I think in general, again, I mentioned when we talked about our platform is, where are ways that we can digitize some of those manual processes, right? So, that can be in a number of different areas. And so, what we typically will do is come in and talk to, again, any number of the employees and say, hey, where do you spend, time with a manual process, whether it's a month-end close process or still lots of pagers and things like that happen, or something that they have to do on a repeated basis that we can come to look in and optimize and automate as part of that process too. And so I know it's a general umbrella, but even with, very tactical things, I've been working with a couple systems to manage some of their medical device management processes and how they have a lot of very kind of archaic processes that are, again, around managing their legacy systems that have been around for a long time. But what we're looking to do is make that experience better, not only for those clinical engineers, but also for the clinicians who are checking out those medical devices and then appropriately billing them. So again, it's a little bit more of a tactical answer, but this was a big pain point for them. And so in general, again, I think there's ways we can look to say, again, how can we automate some of these processes and shave time and money off of that patient care process? So there's definitely a lot of examples there, too, that I'm not even privy to for sure.
Thanks, Omer and Drew. Next here, besides follow-up surveys, what are some of the ways we can track and measure patient experience to gauge and improve our activities?
Yeah, so I'll give that one a shot first. And again, I think a lot of folks gravitate around the HCAP scores, and obviously those are and any sort of NPS score is going to be kind of the be-all, end-all as far as measuring those particular outcomes. And so what I would say, and I think it kind of ties into Omer's last answer, is HCAPs are definitely critical, but look at the bigger picture too, potentially, and what potentially could be affecting and impacting some of those scores, and again, putting together the proper plans around those as well too. And I think there's a question even around proactive, but if historically there's been a ramp up for flu-based activities at a particular time, or even the GI activities, trying to be proactive and reacting to some of those beforehand as well would be kind of my second response there. So Omer, I don't know if you have an answer to that too.
Yeah, I think one thing that you mentioned early on, Drew, that I think is worthwhile to bring it back here is the consumerization of healthcare. It's never going to be a shopping experience because of its nature per se, but we all as consumers have similar expectations for effortless or more convenient, healthcare experiences. So going back to that, there's a lot more transparency for healthcare providers and the experiences that they deliver through patient reviews nowadays. So in addition to the direct feedback that you would get from patients, there's also third-party sites and feedback and sentiment opportunities to leverage. And sometimes patients may not be as direct and straightforward in disclosing their positive or negative experiences. More so the negative ones, they may hesitate. So looking to the patient reviews, finding out patterns also is another way to really find some of those hidden insights that you could leverage for delivering better patient experiences.
Thank you both on that one. So I have time for one more here. So can you share how customer operations can help us improve regulatory compliance? Drew, I'll kick this one back off to you.
Yeah, I think we touched on it a little bit a second ago, but it's really kind of again, those operations with the service lines we mentioned earlier, and again, kind of even starting with how can we optimize the delivery of those services, and even keeping up with some of the regulatory pieces as well too. So again, those things are changing, and again, just that example we mentioned around the change in reimbursement, I think everyone's obviously aware of those things, but there's potentially even things changing as we speak with COVID and around the relaxing of certain constraints too, which may or may not be expiring. So those things are going to change on a regular basis. So being malleable and being able to adopt to some of those regulatory changes and change your service delivery as part of that are pretty critical. Even and again, technology is one piece of that equation, but being able to kind of keep ideally ahead of the curve and know when decisions are being made by the federal government, they may potentially impact things as far as the downstream effect to the providers and the payers.
Yeah.
Well, that is all the time we have left for. Oops, I'm sorry. Go ahead.
Well, I was just going to mention, I think the collaboration piece, as Drew has highlighted, is very critical. So just to underscore and remind that collaborative and cooperative process between different silos is definitely a huge value for that regulatory compliance.
Thanks, Omer and Drew. That is all the time we have left for today's presentation. Thank you again to our speakers and to ServiceNow for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section that you should see on your webinar console, and also fill out the post-webinar survey. Thank you again for joining us, and we hope you have a wonderful afternoon.